arteriosclerosis. Vessels become narrow and hardened. Hypertension. High blood pressure. Cholesterol. Fatty plaque-like substance. Atherosclerosis. Buildup of cholesterol in coronary vessels causing blockage, narrowing. Coronary artery disease CAD. Atherosclerotic heart disease ASHD. Occluded. Blocked. Myocardial infarction MI. Heart attack caused when heart muscle downstream of an occluded artery lacks O2 and dies. Arterioles. Tiny arteries. Capillaries. One-cell microscopic-sized arteries that allow O2 and nutrients to easily diffuse into tissues and cells also collect CO2. Venules. Tiny veins that take CO2 and waste back to heart and lungs. Sinoatrial node SA node. Cluster of specialized cells in your right atrium, natural pacemaker for heart. Normal sinus rhythm. Normal rhythm of heart. Atrioventricular node AV. Within the floor of right atrium, backup pacemaker receives impulse from SA node and transmit it down to both ventricles. Cardiac cycle. Contraction and relaxation of the four heart chambers, creating each heartbeat 0.8 seconds. Systolic pressure. The highest pressure exerted against the artery walls during ventricular contraction. Diastolic pressure. Reflects the lowest pressure exerted against artery walls during ventricular relaxation. Pulse points. Easily palpated large arteries in the body that have a strong pulse can be compressed in case of hemorrhage. AF. Atrial fibrillation. ASHD. Arteriosclerotic heart disease. AV. Atrioventricular. BP. Blood pressure. BPM. Beats per minute. CABG. Coronary artery bypass graft. CAD. Coronary artery disease. Echo. Echocardiogram. HF. Heart failure. HR. Heart rate. HTN. Hypertension. ICU. Intensive care unit. INR. International normalized ratio. LA. Left atrium. LV. Left ventricle. MI. Myocardial infarction. MR. Mitral regurgitation. MS. Mitral stenosis. MVP. Mitral valve prolapse. P. Pulse. CCU. Coronary care unit. CHF. Congestive heart failure. CP. Chest pain. CPR. Cardiopulmonary resuscitation. CV. Cardiovascular. DVT. Deep vein thrombosis. ECG or EKG. Electrocardiogram. PAC. Premature atrial contraction. PT. Prothrombin time. PTCA. Percutaneous transluminal coronary angioplasty. PTT. partial thromboplastin time. PVC. Premature ventricular contraction. RA. Right atrium. RBC. Red blood cell. RV. Right ventricle. VFib. Ventricular fibrillation. VT tach. Ventricular tachycardia. VTE. Venous thromboembolism. Anemia. Group of disorders generally defined as a reduction in the mass of circulating RBC. Aneurysm. Weakening and bulging of part of a vessel wall. Angina. Heart pain or other discomfort felt in the chest, shoulders, arms, jaw or neck caused by insufficient blood and O2 to the heart, usually a symptom of heart disease. Arrhythmia. Loss of heart rhythm. Arteriosclerosis. Thickening, loss of elasticity and loss of contractility of arterial walls, commonly called hardening of the arteries. Atherosclerosis. The most common form of arteriosclerosis, marked by deposits of cholesterol, lipids and calcium on the walls of arteries, which may restrict blood flow. Atrial fibrillation. Common irregular heart rhythm marked by uncontrolled atrial quivering and repeat ventricular response. Brute. Soft blowing sound caused by turbulent blood flow in a vessel. Cardiac tamponade. Serious condition in which heart becomes compressed from an excessive collection of fluid or blood between the pericardial membrane and the heart. Cardiomyopathy. Group of conditions in which the heart muscle has deteriorated and functions less effectively. Congestive heart failure (CHF). Inability of the heart to pump enough blood to meet the needs of the body, resulting in lung congestion and dyspnea. Cor pulmonale. Condition of the ventricular enlargement or dilation from increased RV pressure, also called pulmonary heart disease or right-sided heart failure. Coronary artery disease. Narrowing of the lumen or inner open space of a vessel of heart arteries due to arteriosclerosis and atherosclerosis. DVT, deep vein thrombosis. Development of a blood clot in a deep vein, usually in the legs, also known as thrombophlebitis. Disseminated intravascular coagulation (DIC). Serious condition that arises as a complication of another disorder in which widespread unrestricted microvascular blood clotting occurs. Primary symptom is hemorrhage. Embolus. Undissolved matter floating in blood or lymph fluid that may cause an occlusion and infarction. Endocarditis. Infection of the inner lining of the heart that may cause vegetation to form within or more heart chambers or valves. Fibrillation. Quivering of heart muscle fibers instead of an effective heartbeat. Hypertension. BP that is consistently higher than 140 systolic, 90 diastolic, or both. Ischemia. Temp reduction in blood supply to a localized area of tissue. Malignant hypertension. Rare life-threatening type of hypertension, evidences by optic nerve edema and extremely high systolic diastolic BP. Mitral regurgitation. Condition in which the mitral valve does not close tight, allowing blood to flow backward into the left atrium, also called mitral insufficiency or mitral incompetence. Mitral stenosis. Condition in which the mitral valve fails to open properly, thereby impeding normal blood flow and increasing pressure within the LA and lungs. Murmur. Blowing or swishing sound in the heart due to turbulent blood flow or backflow through a leaky valve. Myocardial infarction. Death of heart muscle cells due to occlusion of a vessel, also known as heart attack. Myocarditis. Condition in which the middle layer of the heart wall becomes inflamed. Pericarditis. Acute or chronic condition in which the fibrous membrane surrounding the heart becomes inflamed. Peripheral artery disease. Condition of partial or complete obstruction of the arteries of the arms or legs, similar to peripheral vascular disease (PVD), which includes both arteries and veins. Polycythemia vera. Cronus disorder marked by increased number and mass of all bone marrow cells, especially RBCs, with increased blood viscosity and a tendency to develop blood clots. Raynaud's disease. Disorder that affects blood vessels in fingers, toes, ears and nose, marked by vessel constriction and reduced blood flow in response to triggers such as cold temp, also known as Raynaud gangrene or phenomenon. Rheumatic heart disease. Complication of rheumatic fever in which inflammation and damage occur to parts of the heart, usually the valves. Shock. Syndrome of inadequate perfusion as a result of hypotension or low BP. Thromboangiitis obliterans TAO. Vascular disease associated with tobacco use, marked by inflammation and clot formation within small vessels of the hands and feet, which may lead to gangrene and surgical amputation, also known as Buerger's disease. Varicose veins. Bulging distended veins due to incompetent valves, most commonly in legs. Angiography. Diagnostic or therapeutic radiography of the heart and blood vessels. Automated external defibrillator (AED). Small computer-driven defibrillator that analyzes the patient's rhythm, selects the appropriate energy level, changes and delivers a shock to the patient. Automatic implanted cardioverter defibrillator (AICD). Very small defibrillator surgically implanted in patients with a high risk of sudden cardiac death that automatically detects and treats life-threatening arrhythmias. Cardiac catheterization. Evaluation of the heart vessels and values via the injection of dye that shows up under radiology. Cardiopulmonary resuscitation (CPR). Emergency procedure that provides manual external cardiac compression and sometimes artificial respiration. Cardioversion. Restoration of normal sinus rhythm (NSR) by chemical or electrical means. Coronary artery bypass graft (CABG). Surgical creation of an alternate route for blood flow around an area of coronary arterial obstruction. Defibrillation. Delivery of an electric shock with the goal of ending ventricular fibrillation and restoring NSR. Electrocardiography (ECG EKG). Creation and study of graphic records of electric currents originating in the heart. Event recorder. Portable monitoring device that transmits heart rhythms by telephone to a central lab where dysrhythmias can be detected and analyzed. Holter monitor. Portable device worn by a patient during normal activity that records heart rhythm for up to 24 hours. International Normalized Ratio (INR). Standardized method of checking prothrombin time (PT) used to monitor and adjust warfarin dosage in order to maintain a balanced BTW and clot prevention and excessive bleeding. Pacemaker. Device that can trigger the mechanical contractions of the heart by emitting periodic electrical discharges. Partial thromboplastin time (PTT). Measure of blood clotting time used to monitor heparin therapy. Heparin is an anticoagulant medication that slows the clotting time of blood. A balance must be maintained BTW and clot prevention and excessive bleeding. Percutaneous transluminal coronary angioplasty (PTCA). method of treating a narrowed coronary artery via inflation and deflation of the balloon on a double-lumen catheter inserted through the right femoral artery. Prothrombin time. Procedure that measures the clotting time of blood used with the INR to assess LVLS of anticoagulation in patients taking warfarin. Stress test. Treadmill test that can show if the blood supply is reduced in the arteries that supply the heart. Transesophageal echocardiography T. Study of the heart via a probe placed in the esophagus. Troponin. Protein released in the body by enlarged heart muscles, considered the most accurate blood test to confirm the diagnosis of ANMIL. Anticoagulant. Decrease the clotting ability of the blood. Antiplatelet agent. Prevent blood clot formation. Angiotensin-converting enzyme inhibitors AC. Lower angiotensin II LVLS, expand Blues vessels and decrease resistance. Angiotensin II receptor blockers inhibitors. Prevent effects of angiotensin II, keep BP from rising. Beta blockers, beta-adrenergic blocking agents. Decrease heart rate and cardiac output. Calcium channel blockers. Interrupt movement of calcium into cells, decrease the heart's pumping strength and relax blood vessels. Diuretics water pills. Remove excess fluids and sodium from the body, relieve the heart's workload. Vasodilators. Relax blood vessels and increase blood supply and oxygen to the heart, reduce the heart's workload. Digitalis preparations. Increase the force of heart's contractions. Cholesterol lowering. Lower LDL, raise HDL, lower triglycerides LVLS. Arteriosclerosis. Vessels become narrow and hardened. Hypertension. High blood pressure. Cholesterol. Fatty plaque-like substance. Atherosclerosis. Buildup of cholesterol in coronary vessels causing blockage, narrowing. Coronary artery disease CAD. Atherosclerotic heart disease ASHD. Occluded. Blocked. Myocardial infarction MI. Heart attack caused when heart muscle downstream of an occluded artery lacks O2 and dies. Arterioles. Tiny arteries. Capillaries. One-cell microscopic-sized arteries that allow O2 and nutrients to easily diffuse into tissues and cells, also collect CO.